Division of Interventional Pulmonology, Fortis Memorial Research Institute, Gurugram. EUS-B. EUS-B stands for endoscopic ultrasound using a bronchoscope. Seagull Sign. EBUS scope is introduced to the esophagus. The left adrenal gland appears as a seagull with an enlarged wings on the left side of the abdominal aorta/celiac trunk. Case number 1. A 22-year-old female patient was admitted with bilateral pneumonia, requiring intubation and mechanical ventilation. The CT scan showed a large heterogeneously enhancing nodular lesion involving left adrenal gland measuring 41.6 by 36.7 millimeters. The EBUS bronchoscope was passed into the esophagus after sedating the patient on ventilator. After localizing the liver, the EBUS scope was rotated clockwise until the abdominal aorta was identified. The celiac trunk was seen originating from the abdominal aorta. The EBUS scope was pushed down and slightly rotated to identify the big left adrenal mass. The needle was passed through the EBUS scope, which was facing almost 6 o'clock position. The EBUS needle was passed into the left adrenal gland mass and was agitated 15 to 20 times. The needle was then pulled out to collect the aspirate for the smears and cell block. 3 more passes were made with 15 to 20 agitations in each pass to collect the aspirated specimen, which was found to be adequate on rows. The cytology and histopathology confirmed the diagnosis of Ewing's sarcoma/primitive neuro-ectodermal tumor, or the PNET. Case number 2. A 64-year-old male patient presented with a nodular opacity in the anterior segment of the right upper lobe. The EBUS and fluoroscopy-guided bronchoscopy failed to localize and biopsy the lung lesion. The patient had a large PET FDG avid left adrenal mass measuring 35 by 45 millimeters in size. The EBUS bronchoscope was introduced to the esophagus. The left adrenal mass was localized just left to the abdominal aorta. The EBUS needle oriented at the 5 o'clock position in the EBUS scope was passed into the left adrenal gland mass. The aspiration suction was applied, and the needle was agitated. Four passes were made to obtain an adequate sample from the adrenal mass. The EUS-B-guided needle aspiration of the left adrenal mass established the diagnosis of metastatic small cell carcinoma of the lung.